Namaste and welcome, Bachelog. So good to see you all. Today, we are going to get into two really important families of antibiotics. I'm talking about the aminoglycosides and the macrolides. Trust me, you are going to be using these throughout your careers. So, Cello, let's get started. Okay, so here's our game plan for today. We're going to introduce the two families, then we'll deep dive into the aminoglycosides, figure out how to choose the right one, then we'll do the same for the macrolides, and finally, we'll wrap up with the most important points for your exams. Simple, hey not?
Now you might be thinking, sir, there are so many new, fancy antibiotics out there. Why are we focusing on these old ones? It's a very good question. And the answer is simple. Because these classics are still your frontline soldiers for some of the most dangerous infections you will ever see. Knowing them inside out is not optional. It's what makes you a good doctor.
Okay, so let's get into it. The best way to think about this is like two different types of fighters. On one side, you've got the aminoglycosides. These are the heavy hitters, the big bodybuilders, immensely powerful. But, they can be a bit clumsy and cause some damage. On the other side, you have the macrolides. They're the versatile experts, smart, adaptable, and a whole lot safer. Two very different philosophies for fighting germs. So, let's begin with the first family, the powerful aminoglycoside clan. Listen, these are your big guns. When a patient is seriously ill, maybe with a nasty hospital-acquired infection, and it's a gram-negative bacteria, these are the weapons you reach for. They are absolutely critical.
And just look at who they're fighting. This is a who's who of bacterial bad guys. You've got Pseudomonas, Notorious. You've got Klebsiella, Proteus. These are the troublemakers that cause havoc in ICUs. Aminoglycosides are designed to take these specific enemies down, and they do it very well.
Okay, everybody please, full attention here. This is non-negotiable. With great power comes great responsibility, right? The dark side of aminoglycosides is that they are potentially toxic. They can damage the ears, that's ototoxicity, and they can damage the kidneys, that's nephrotoxicity. You have to remember this. This isn't just for your exams, this is for your patient safety. You must monitor kidney function, always.
Now here's where you have to be a smart doctor. It's not enough to just say, give an aminoglycoside. Which one? They're not all the same. You have to be a sharpshooter, picking the exact right weapon for the specific bacteria you're fighting. So let's look at the options.
So let's break this down. For your typical Pseudomonas infection, tobramycin is a great choice. But what if you're facing a superbug, a bacteria that's resistant to everything? That's when you call in the special forces, amikacin. You see, it resists the enzymes that bacteria use as defense shields. It's a reserve drug for the toughest fights. And neomycin? It's a good choice for things like Klebsiella and Enterobacter.
And then there's neomycin. You could say the black sheep of the family. It's just too toxic to inject into the body. But it has some very clever, very specific uses where we don't need it to go systemic. We can put it on the skin for infections, we can give it orally to sterilize the bowel before surgery, and in hepatic coma, it reduces the ammonia-producing bacteria in the gut. So it's very useful, but only when it stays local.
All right, let's completely switch gears now. We're moving away from the heavy hitters and meeting our second family, the versatile macrolides. Now, these are your reliable problem solvers. The two big situations you should think of them for are 1, your patient has a penicillin allergy, or 2, you suspect an atypical pneumonia. These are your go-to guys. So, how do these clever drugs work? Well, imagine the bacterium has a little factory inside it, building all the proteins it needs to survive. The macrolides sneak in and basically jam the factory's machinery. They bind to a part called the 50S ribosomal subunit and just stop the whole assembly line. No more proteins, no more bacteria. It's a beautiful, elegant mechanism. And this is their real superpower. Look at this list. They are fantastic against these atypical bugs, Mycoplasma, Legionella, the kind of sneaky bacteria that cause walking pneumonia and don't respond to many other antibiotics. And they are the drug of choice for whooping cough. So useful.
Now, like any great family, this one has a history. It didn't just appear out of nowhere. Let's look at how the macrolide family has evolved over time, starting with the granddaddy of them all and moving to the modern marvels we use today. So, let's meet the patriarch, erythromycin. This was the first one, a real game changer back in its day. It was a fantastic alternative for people allergic to penicillin, but it had some issues.
It was notorious for upsetting the stomach, it got destroyed by stomach acid so absorption was poor, and it messed with a lot of other drugs. A pioneer for sure, but with some serious drawbacks.
And this is where the story gets good. The next generations, clarithromycin and azithromycin, basically fixed all of their grandfather's problems. Look at this. Dosing went from every 6 hours with erythromycin, which is a pain, down to just once a day with azithromycin. Stomach problems? Much, much better. And they even improved the spectrum. Azithromycin is the undisputed modern champion of this family.
Just one single dose. I want you to let that sink in. A single 1-gram dose of azithromycin can completely cure chlamydial urethritis. This absolutely revolutionized treatment for a very common disease. Why? Because it has a super long half-life. It just stays in the tissues doing its job for days. This is a wow fact you need to remember.
Okay, Bachelok, pencils down. Let's do a super quick revision. If you walk away from this lecture remembering only 2 things, let it be the next 2 slides. These are your high-yield, must-know golden rules.
For aminoglycosides, the rule is this. They are potent killers for serious gram-negative infections. But, and this is a big but, you must always monitor for kidney and ear toxicity. Potent, but potentially toxic. Got it? And for the macrolides, your golden rule is think of them first for atypical pneumonia and for anyone with a penicillin allergy. And who's the star player of the team today? It's azithromycin, because it's just so convenient and well tolerated. Bilkul clear.
So, there you have it. The heavy hitters and the versatile experts. You now have the knowledge of these 2 powerful families. But this knowledge isn't for an exam. Not really. It's a toolkit. The real question is, how are you going to take this knowledge and use it wisely and responsibly to help your patients? That, my friends, is the real challenge and the true privilege of becoming a doctor. Thank you.